All right, good day, friends. We want to welcome Dr. Keith Armitage from University Hospitals here to chat with us briefly about the coronavirus and some of the latest developments, some of which includes some confusion, Dr. Armitage. We're talking about some issues regarding the WHO, the World Health Organization, in regard to asymptomatic patients. Can they spread this disease or can they not? Who's to blame for this situation? Can you speak to that a bit?
Yeah, I think some of the communication from the WHO has been a little suboptimal from the beginning. First they were confusing about masks, which I can maybe talk about later. One of the officials from WHO said that patients who never develop symptoms are not at high risk for spreading coronavirus. And I think this was misinterpreted because we know without question that patients can spread coronavirus for 2 or 3 days before they have symptoms. So the messaging from the WHO is interpreted as if you're around somebody who doesn't have any symptoms of illness, you can't get coronavirus. And that is just not true. We know from good studies that people can be highly contagious before they have symptoms. So patients who never have any symptoms are not at very high risk for spreading the disease, but they can. But a lot of the spread of coronavirus occurs in individuals who are very contagious for 2 or 3 days before they get sick. And that's really important.
And that speaks to something that's called pre-symptomatic, right?
Yeah, pre-symptomatic means you have the virus, you're contagious, you're spreading the virus, but yet you don't have any symptoms of the virus. And that's a really important part of this pandemic. I think one of the reasons that this pandemic has been much harder to control versus the first SARS in 2002 is that we didn't see this pre-symptomatic or asymptomatic spread like we are with the SARS-CoV-2.
Have you found yourself learning something new, it seems, every week? This is a very fluid situation, and that also lends to a lot of the confusion, I guess is what I want to ask, because
Yeah.
people have just resorted to, you know what, I'm just going to stay in my lane. I'm going to stay at home as often as possible. That has to be the safest bet. But there's just so much that we don't know.
Yeah, I think the public should know this is a new disease, and again, that's why some of the messaging is confusing because we do learn new things. I'll give you an example. About a month or so ago, people were hearing reports that patients would get the disease, test negative, then test positive again. And there was concern that people could get it more than once, and people didn't know what this meant. There was a really high quality study from South Korea that showed that people who get the disease, get COVID-19, can, even when they've recovered, you can detect the virus, for weeks sometimes, but they're not contagious. And this was studied very carefully. And so these cases of reinfection were really just people who are what we call shedding little particles of virus that couldn't cause an illness. And that was a really important study. More and more studies show the importance of masking. Countries that have done widespread public masking from the beginning have the lowest rate of deaths in the world. And there's more and more data how masking is important. And that's why the messaging about patients with no symptoms was concerning to me, because I'm an advocate for masks. And one reason that we should wear masks is because we can be around people who don't seem sick or don't have any symptoms that we can get the virus. One of the first really well-studied sort of super spreading events was this choir practice in Seattle, where there were 60 people at the choir practice, 58 of them got the virus. I think 2 or 3 had a fatal illness. And the person who spread it had almost no symptoms. And that's just an example. So indoor events where people are congregating together indoors continues to be high risk, even if there's no one who really seems sick.
And just to further prove that I am following doctor's orders, here it is.
All right.
Right here. Never leave home.
Mask.
Yes, got to keep it. I got a clean filter in there as well. The sunshine, it can be alluring and it can welcome people outdoors. And so we see more people congregating. That's not exactly what we want, especially since we don't know who's come into contact with whomever is out there in the world.
Yeah. Yeah, I think congregating outdoors is still concerning, but I don't think it's the same high risk as indoors. Again, the whole goal of this pandemic is to slow the spread as much as we can. And indoors, you see these events where lots of people get it. There was in South Korea 2 or 3 weeks ago, there was one individual who went to 5 bars and nightclubs in one night and infected 100 people. Outdoors, when you have a breeze and the sun, I think it's less likely that one person's going to infect, tens of people. I think, if you're outdoors and you're more than 6 feet away from somebody, it's really low risk. If you're outdoors with a mask, I think it's very low risk. And if you rate risk, the biggest risk is being close to people for prolonged periods of time indoors. The lowest risk, other than staying home, lowest risk is being outdoors and having some social distancing or wearing a mask. I think what infectious disease doctors and epidemiologists are trying to convey to the public is we know we have to open up where people can get jobs. The economic suffering can be, alleviated, but we want to do it in a way that's safe. And that's why masking is so important and doing social distancing that doesn't affect the economy, and to allow things to stay open so people can get back to work. And that's why staying away from people when it doesn't affect the economy and wearing masks, particularly indoors. I go grocery shopping, or my wife goes grocery shopping, and almost everyone has a mask on, or in some cases, everyone has a mask on.
Right.
Then you walk through neighborhoods with bars and restaurants, and you see lots of people with no masks on, and it's just so disappointing to me, because I think down the road we're going to see
so
more
simple,
people,
right?
Yeah, we're going to see
It all
more
be so
people.
simple.
Yeah, go ahead. Sorry. Yeah.
No, I was just saying it could be so simple, as you were saying it was disappointing.
Yeah. And so I'm not someone who says we should stay shut down forever, but we should avoid high risk activities. And high risk activities are being indoors, close to people for prolonged periods of time when you don't have to be, when it's not necessary for your life.
Right. Got a couple of questions here, actually quite a few. And we'll try and get through all of them, guys. We want you to hit us with the questions. I'm going to try and squeeze these in because doctor is a working doctor, very much busy. So we don't want to keep you too long this afternoon. But first up, Tammy Collins, her question, if you kind of touched upon this, if you test positive, how long are you contagious? Do we know that answer? And
sorry.
No, go ahead.
That's a great question. And the CDC says you're considered contagious for 10 days from a positive test or 3 days from your last symptoms, whichever is longest. So typically it's 10 days unless you stay symptomatic a long time. A lot of people who don't end up in the hospital, get over their cough and fever just in, 3 or 4 days. So it's 10 days from a positive test or 3 days from your last symptom, which is ever longer. And studies around the world and the Center for Disease Control recommends this. After that period of time, you're not considered contagious. And it's confusing because the test for detecting the virus in people is super sensitive, and it can detect dead pieces of virus that can't, cause someone to get sick. So you can test positive in some patients for weeks, but they're detecting little pieces of viral RNA that is not capable of causing an infection. So it's 10 days from a positive test or 3 days from last symptom, which is ever longest.
Okay. Another question, and we've talked about how folks are so cooped up with quarantining, wanting to know, Carolyn Anderson wants to know, would it be safe to visit outside with grandkids if you socially distance yourselves?
That is a fantastic question, because I really advocate for that. If you're outside and you're 6 or more feet away from people, it's really low risk. And, really, since this began, people that want to visit their elderly neighbors or their relatives or their parents or grandparents, the weather's decent and you can sit outside and stay 6 or more feet away, it's very, very low risk. Again, outside, low risk, indoors, high risk. And so I'm a big advocate for the grandparents having the grandkids come over. Stay 6 feet's not that far. Stay 10 feet away to be careful. You can still visit with people. Now, I have elderly parents in their 80s and 90s, and my siblings who live nearby, when the weather's nice, they would sit outside, 10 feet away and visit them. And I think that's very safe.
Doc, they just want to spoil those grandkids.
Exactly.
That's Cindy wants to know. She was wondering. She was sick in November through much of December, had all of the symptoms of coronavirus. Could that have been it? There's a lot of people asking that question. A lot of my colleagues as well.
Yeah, that's a great question. I think it's highly unlikely that people in Northeast Ohio were getting coronavirus in December, let alone November. And just in my own world where I work, I have patients. I have tested a few people for the antibody test, which is another way to see if someone's had it. And really, no one who was sick in January or February so far has tested positive. So there may be some people who had it in February and may test positive, but I'm pretty confident that it'd be very rare in January in Northeast Ohio, and not here in December or November.
And Eileen is making mention of something that's very important: pools opening, movie theaters. I feel these are not good decisions. And she just wants to know if that's going to exacerbate the problem. We've talked about pools some in the past couple of weeks, but especially movie theaters, those are areas where you are sitting for at least an hour and a half, and you don't know the individuals, even if you're a few seats apart from them, right?
Yeah, I think it's a good contrast because, again, it's indoors for prolonged periods of time around people. I think movie theaters would be very high risk, and I would avoid them. And even if everyone wears a mask, people have a tendency to pull them down, put them on their chin. It's pools, on the other hand, if a pool limits the density of people a little bit, but people wear masks, coming and going or going to the concession stand. Outdoors in the breeze and the sun is pretty low risk. I think, there's no evidence that COVID is going to be spread in the water in the pool. So a pool that doesn't have too many people outdoors with sunlight and a breeze with some masking, I think is low risk.
Great. And you know what? Mary Beth just wants to give everybody a hug. She says, is there a prediction on how many months from now social distancing may no longer be necessary? Do we know that answer right now?
Yeah, I'm so sorry to give this answer, but until we have a vaccine that we think that works or a treatment we think that works, I think we need to do this. And, vaccine development is incredible. It's a pace literally never seen in the history of mankind. And I think that there's a reasonable chance we're going to have a vaccine by November, December, January. It's possible we could have a breakthrough treatment. Right now, none of the treatments are really that dramatically effective. Until we get either a good vaccine or a treatment, this is a once in 100 years event.
Right.
And it's impacting our lives so much. And people are getting what I call pandemic fatigue.
Yeah.
Back in March, every day we were tuning into Governor DeWine's press conference because it was new and dramatic. But the pandemic is not gone. It's still here. We could see more deaths. We could see more cases. We could see another spike. In Ohio, we were very successful in limiting the spread because we acted early. And I think all of us are at risk for having complacency because of that. And we see that in the bars and restaurants. So people should know that until we have an effective treatment, we're at risk. And it's not just frail elderly. We do see, people in their young people get admitted to the hospital. We're seeing fatal cases in people in their 50s and 60s. So we got to keep being careful till we get into this. We have to find that right balance. Getting outside, visiting friends in a safe way, shopping, going to doing fun things in a safe way.
Don't say shopping, doctor. Don't say shopping.
I mean shopping with a mask on.
My wife is going to say, he said shop.
Yeah, right. Yeah. Masks are really important. And,
right.
Governor DeWine came out on the Monday for reopening and said mandatory masks in Ohio. He had a lot of pushback about civil liberties.
Right.
People, and I don't want the government, not going to talk about that, but compliance with masking is not great. The first major kind of Western country to say everyone wears a mask was the Czech Republic. And it was like a social movement there. Everyone was into it. All the little ladies clubs, they made like 1 million masks a day for 2 weeks, They have one of the lowest death rates in the world, despite being near France, near Germany, near Spain, near Italy. So masks, there's more and more data about masks. That's why masks are upsetting. The lack of masking concerns me because I want people to get back to normal as much as they can. Go shopping, go to the grocery store, do things. And if people would just wear masks, especially indoors or in crowded outdoor situations, it would really limit the spread and save lives. And the whole goal is to save lives until we get to the end of this. And the more we can limit the spread, the less people who will die. And it's funny because people say, I don't want to go to I don't want to be told to wear a mask in a restaurant. Well, it's no shirt, no shoes, no service. That's a societal norm. Our society says you can't drive drunk because it's just against the rules. And really, masking is along that vein. It's so important to get through this pandemic until we get to the end to limit the spread. And I wish people wouldn't think as masks as some kind of a social stigma or some imposed rule from Dr. Atkin or something. It really is common sense to get to the end of this with as little death and illness as possible.
Absolutely. And doctor, I know that we are between appointments right now. So please tell me if you're up against it, because I
got about 10 more minutes.
You got 10 more. Okay. We'll try and squeeze in some more. I don't want you to have to delay an appointment there, but you were talking about some of the treatment that's taking place. We'll kind of combine a couple of these questions here because Kim Robinson Reynolds asks, what is your feeling about schools reopening? I'm a very high-risk person, and I'm very worried about going back to school in the building with the students and other staff members. Could you please comment on what the risk level is that you think it may be? Also, Eileen saying kids and necessity for masks when returning to schools. Hey, Doc, I've got a 5-year-old. Yeah. I have trouble getting him to keep shoes on in certain spaces. So, you can imagine the issues with the mask. So could you kind of speak to both of those questions there?
I think this is a really hard question because closing schools was so disruptive for the students and just for people with children. On the other hand, I think it's a really important intervention to prevent the spread. I think the good news is we have another month or two to kind of get data and get an understanding and come up with a plan. I'm still worried about schools because you're going to see spread. I mean, I am taking care of a patient now who probably got this from a small, one of their children who's under 10. And the kids, I mean, there's been some data about this illness in kids. It's rare. In general, kids don't get that sick, but they continue to spread to adults from kids. And so I hope we can find a way to open schools, have less density in the classrooms, open schools, maybe staggered schedules, some masking. I think we need to get more data from around the world. There's other countries that opened schools, look how they did it, how it was successful. And, I guess, I don't know exactly when schools open, but you think late August, so I think we have another, 4 to 8 weeks to really look at this carefully and come up with the best plan. And week to week, think about this. It's a really hard question. And I don't think it's an easy answer because I certainly appreciate the impact on people. But I'm worried that schools will increase the spread, that not that the kids are going to get, really sick or, it'd be rare for them to get really sick, but we'll just see more cases in their parents and their grandparents, and it'll just spread more. And it's a worry I have.
Jennifer Westfall Bailey, can you speak to the issue of blood clotting related to COVID-19 and things of that nature?
That's a great question because I think when this disease started, we thought of it as a respiratory tract disease, right, and a pneumonia, but it affects your body's vascular system, and it triggers a tendency to clot, and that's really, really important. So the people that get significantly sick who come in the hospital, I mean, pretty much they're all on blood thinners, and the clotting is really important. So we've learned a lot about this virus in the last couple of months, and there's no question that the people who get significantly sick from this virus, clotting is really important. I think all the hospitals have protocols for blood thinners now based upon the lab tests. So there's certain lab tests in the COVID-19 patients that indicate that this patient has a clotting problem and they have a tendency to clot. And so putting people on certain types of blood thinners who have a more severe case is really critical. And there's certain, pretty easy to do blood tests that indicate whether there's a clotting risk or not. And
Mhm.
that's a critical element. And I think that since we've learned this in the last couple of months, I believe we're saving lives by getting people who come to the hospital who have these blood tests that show this clotting problem, getting them on blood thinners. And it's a really critical question. Clotting is a big part of this illness.
Um, Clearly, I don't have the credentials you have, but you touched on this earlier. Michelle Witkowski Hurst says, should people with asthma wear a mask? I have asthma. I wear my mask. I showed it just a few moments ago there, Michelle. It may be a different color tomorrow. I make sure I wear that thing out in public. Another Michelle is Michelle Giaffredo, I believe. I hope I pronounced that properly. Uh, what about the multitude of antivirals that are in process? Why the push for a vaccine for something with such a low attack on a healthy immune system?
Yeah, like, can I answer both those questions? So far, asthma, mild asthma or moderate asthma, has not been a big risk factor for a serious illness.
That's
It's
good to
more,
know.
more like obesity and diabetes. Those are the big ones that we're seeing have the most concern for. Um, and the second question, so far in the United States, we've seen, I think, 110 or 115,000 deaths. If we let the virus run wild to the point where enough people were infected, the spread would stop, we'd probably have 1 to 2 million deaths in the United States. That's why we need a vaccine. If the virus just ran its course with no treatment and no effort to slow it down, it would probably be 1 million deaths in the United States. And it's not just people at the end of life, super elderly. We're seeing people with jobs and families and who are still active and productive citizens. And not that I'm not putting any value on any death, but the idea that it's just like a select group of people. So without intervening, we would see a lot more death and suffering than we are. And again, the vaccine, if we can get to a vaccine with, 200,000 deaths versus 1 million, that would be a huge victory. Most experts think in order to get to the point where the spread would slow down based upon the number of people infected, it's anywhere from 60 to 80% of the population. New York City has about 20% infected, and their death rate would correlate to 1 million people in the United States, and they're only at 20%. So it's important to get a vaccine to prevent this really worldwide high death rate. And people are looking at treatments. People are looking, the one medicine that's gotten a lot of publicity is called remdesivir. The effect is mild in a lot of patients. Hydroxychloroquine is very political. It doesn't appear to work very well or work at all. We're still getting data. So to this day, there's really no treatment that is like getting a shot of penicillin, for pneumonia or something. And that's why prevention and social distancing is so important. And that's why, the world's rushing to a vaccine. There's unprecedented efforts. There's lots of good candidates. But to think that we don't need a vaccine, I'm sorry. If you can think about 1 to 2 people in the United States, 1 to 2 million people dying, if we just let it run rampant, that would just be awful.
And on that note, doctor, I know you've got to run. You're up against it. I can't thank you enough for your time. I encourage you guys to take all of that advice to heart as we navigate this pandemic, and take all the precautions that we must take, including wearing our masks in public. Right, doctor?
Mask protects other people. If everyone masks, we're going to see a lot less disease and death. And it's more and more data every day come out showing that less people die if we all wear masks.
Absolutely. University Hospital's Dr. Keith Armitage, thank you so much for your time, and you have a great day.